We spoke with Superintendent of Needham Public Schools, Dr. Dan Gutekanst, about the district's priorities when choosing a reopening plan. Here are his thoughts on in-person learning, remote learning, or a hybrid option.
The priority is the health and safety of our students and our staff. I know there are a lot of folks out there, and including the American Academy of Pediatrics and others, who remind us that children are less likely, apparently, to get this disease. And that therefore it's safer for them to return, if you will, in public or in school. And I understand the science, and I agree with that. What folks typically leave out of that equation, though, is that children don't teach themselves all the time. They're actually adults who teach them. And it's the adults that I also have to think about, that I also have to be concerned about for their health and safety. We have adults in our buildings anywhere from 20 to over 70 years old who are working with our children every day. Bus drivers, nutrition service workers, teachers, principals. And so I need to be concerned about the health and safety of those staff members as well, who will be interacting with these children. So health and safety is our primary consideration on which model that we're going to tackle. The other consideration is, what does the teaching and learning look like? In a model in which we bring everybody back to school, but provide for 3 feet of social distance, which is what the American Academy of Pediatrics suggests is the minimum, we can do that. We can fit all the students in. We can squeeze everybody in. And yet I worry that, is that going to be the best public health model? And is that really going to be the best teaching and learning model? To say that we have everybody in the classroom with all the desks facing forward and absolutely no flexibility for how that classroom is shaped, because our classroom environments are active, they are typically not in rows, children are working together. We're not going to be able to do all of that, because teaching and learning, school will be different this year. But to the degree that we can mitigate that, to the degree that if we could provide for a smaller number of children in each classroom, that's going to allow our teachers to have more flexibility with teaching and learning and make it more like we expect in Needham and what we really believe our children need. If we cram them all in, I'm not sure it's going to happen. So, in answer to your question, our students and staff health and safety is the driving factor in whatever model I'll ask the school committee to adopt. And secondly, I want to be able to reassure the school committee and the community that the teaching and learning model is rigorous, is challenging, and will reach every child. And if I don't feel that any one of the models can do that, then I want to go with one that I think will.